All right, for those of you who are staying with us or just joining us, you are watching Fox's live stream update with the latest news, of course, always on the coronavirus outbreak. Now a pandemic. We've been doing this every day. We are going to be doing this every day, starting at 10 o'clock in the morning on the Pacific Coast, 1 in the afternoon out on the Eastern Coast. Right now I want to turn to Dr. Mike Cirigliano again out there with Penn Medicine. Doctor, thanks for joining us. Anything concerning you the most out of this? I know we've had a lot of questions, but if there's one thing that you really are concerned about, what is it?
Well, I think I'm concerned about the loss of life. The fact that there could be a fair number of casualties from this virus. And we often, and I often get a call and questions about, well, the flu kills 36,000 people a year at least. And that's every year, and no one makes a big deal about it. What I'm worried about with this is, as I had said earlier to you, Mike, if the numbers are correct and the population, 70% of the population gets infected, remember, the difference between this virus and the flu is that no one has immunity. No one, until you get the virus and then you survive, or down the road if you get a shot, you get immunized. So that's the concern I have, looking at people especially in the vulnerable positions like nursing homes. And you heard President Trump recommend that we not have non-essential visitors coming to visit. My mother was in a nursing home for a number of years, and you really, I think, need to consider locking them down for a while.
Yeah,
so that bothers me. The other thing that you mentioned, Michael, the other thing from an economic trade point of view, many of our medicines are made with ingredients from China. And so the other concern I have is once we get through this initial 3-month period is what's going to happen to all my patients that can't get essential medications. Okay. That's the other thing that keeps me up at night. I have a number of levels of concern.
Well, let me ask you, let me talk about this. The president addressed the nation last night, and he did mention the 30-day travel ban that will go into effect from people from Europe to the United States. That goes into effect tomorrow night. House Speaker Nancy Pelosi is out there talking about that. She's against it. Listen to what she had to say here.
I had a conversation with the Vice President and Dr. Fauci last night when they called to inform me of this. Dr. Fauci said it was a scientific medical decision. I have great confidence in Dr. Fauci. It's just strange because they're saying it's because it's easy to travel among these countries, but they're separate from the UK. Well, you can just get in the channel and you'll be in the UK. So again, it's a decision they made. It has its ramifications. We'll see whether it's worth the trouble. But again, I'm here about what we can do to go forward for America's working for putting families first without having a criticism of one of the other things that the president is doing. I do think, as Chuck and Leader Schumer and I said in our comments last night, testing, testing, testing. That's the only way you're going to learn about the epidemiology, how this is spread.
Okay, there's the House Speaker talking about testing, testing, testing. What do you say, Dr. Mike? I mean, is the travel ban too little too late, or is it something that we need here?
We live in a global world that it keeps shrinking. I think it's the right thing to do. And I want to state, this has nothing to do with politics. I'm talking about medicine. If you have people that are traveling through continents in close quarters, there are studies, Mike, that show if someone coughs on an airplane, viral particles can go 3 rows forward and 2 rows back. So I don't know what science she's talking about. The science that I've read is that if you're on a plane, you are in close quarters. And we use 6 feet as a distance that allows you not to be at risk. So if you're 6 feet away, what airplane, Michael, have you ever been on where you're 6 feet away from someone?
I haven't been on one, Doc.
They're basically on your lap.
Exactly. You know what? And my 2 kids, when we travel, and if I'm in 12A, we get on first, usually, especially Southwest. I'm wiping down 12A, 12B, 12C, 12D, probably the whole row. I mean, I was doing that before all of this, so I'm with you on that one. You know what? You did a great job with the viewers. They're sending more questions to us, so we're going to bring another one back right now. This is from Melody. She asks, if hand sanitizer, sorry about that. She says, is hand sanitizer with a 2019 expiration date still effective?
Well, there's been a lot of debate about expiration dates and whether it's something that is accurate or not. If you have it and you don't want to use it, send it to me, please. I'll take it and I'll use it with open arms. So use it, please. Go ahead. I think it's just fine.
All right, let's do another one. This one is, can COVID-19 hide in tap water? And there's a follow-up here. There's a follow-up. Can boiling tap water kill the virus? Your thoughts?
Well, let me put it to you this way. As I have mentioned before, the virus can stay on inanimate objects for a long period of time. If there is a moist environment, I think like a kitchen sink, if you will, yes, I think the virus can certainly, if you cough and aerosolize virus in the sink area, even if there's water there, it can certainly stay there for a period of time. Now, boiling water, again, I have to tell you, I wouldn't depend on that. I think that I plan on boiling water. I think that using that in cooking is just fine. But basically what we're worried about here is not so much what's in the water, it's what's on the countertops. I would not stop boiling water or worrying about that. I think that's kind of overkill. And I happen to be Italian. I will boil water to make my pasta, and I love it, and I'm not going to stop.
All right, good. I like it. I like pasta as well. I got a question myself, actually, because I think it's interesting that in Seattle, public schools there have shut down. You know, more than 100,000 students affected by this. Down south in California, in the city of San Francisco, they've decided not to shut down the public schools. Now, the health department there is saying, look, coronavirus and children, it seems like children are okay. They're not getting hit by this virus. In Seattle, obviously, people are a little bit more concerned. They have more cases up there. I do find it interesting, though, about children and coronavirus and why they're not getting hit as much as the older population. And I know that the science is there. We're learning more about it. But what would your recommendation be out there to school districts? Should they close or not?
Well, if you have children like I do who are 11 and 8, Michael, I got to tell you that even before coronavirus, it was a breeding ground for all kinds of things. And I must say, I've had more gastrointestinal viruses ever since I had children than I ever did before. And it's just a breeding ground. Little kids in particular, they touch their nose, they touch their face, they touch the desks. And it's not the kids, thank God this virus does not predominantly affect children. But what about the teachers? What about the relatives of the teachers and the older folks that are related? Those are the things. This is a time, in my humble opinion, for social distancing. And if we need to do this, we do it. Yes, is it going to be inconvenient? If the kids are home, what is mom and dad going to do? The bottom line is, though, if we're going to get a handle on this and suppress this virus like they did in China, we need somewhat of a draconian approach to reduce the spread of the virus. I think schools need to close and do virtual learning at home. We have the technology and we can do it.
You talk about your children. I have a 7- and 9-year-old, and their school is shut down, and I'm all for it right now because they're home. They're doing the virtual schooling. They've got papers. It's new to me, you know, so this is kind of different. We were setting up a spreadsheet last night, my wife and I, saying, all right, from 9 to 10, we're doing this. You know, we're both working parents, too, so we're bouncing off each other here. But I think being at home right now over the next week or two is the best thing. One more question from a viewer, Dr. Mike, if we can get it to you. Some people are trying to limit their exposure by avoiding the gym? I've had this debate too, actually, because I go to the gym every now and then. But what about public pools? What about public pools? And that's from a KTVU viewer out in the Bay Area.
Well, like anything else, and it's funny that you bring up public pools. Back when polio was very, very common, polio was thought to be related to pools and water. And so people would avoid pools, and it was found not to be the case. So, look, there's chlorine in pools, and the pools that I've been in have been very, very chlorinated. So that's number one. The other thing is that besides the pools, you have to understand that I'm getting a hard rap here, so I got to run. Bottom line is, Michael, we should not panic. If you want to go to the gym, I think it's a good idea. Wipe down the gym equipment before you go, and don't get closer than a couple of feet, like 6 feet, to other people, and I think you should just be fine.
Wiping down before I get on the bike, wiping it down after I get off the bike. That's the way to go. Dr. Mike, great conversation once again. Appreciate all the information and, of course, the feedback.